Hello, everyone. I'm so glad that PCOS patients are finding our series useful. Hello, I'm Rashmi Gopal. I'm an integrative nutrition health coach. And we have Dr. Anupama here, who's an Ayurvedic fertility specialist from Shrestha Ayurveda. And let's explore some more questions that you've sent us today. Welcome, Doctor.
Hello, Rashmi.
Doctor, how can you throw some light on how Panchakarma can help PCOS patients? Because I've seen that it's been helping so many people. So, people would love to understand more about it.
Sure. I'm very glad that Panchakarma has becoming more popular because I don't think any other system of medicine has something as unique and powerful as Panchakarma. And I also see a lot of interest about its benefits. So basically, let me, in a few words, tell you what Panchakarma is for people who have no exposure to it at all. So Panchakarma, basically the word itself means five therapies. Pancha is five and karma is actions or therapies. They are these unique therapies in Ayurveda which are used for multiple purposes, for deep cleansing, for nourishment, for correction, and many other conditions we use it. For many other purposes we use it. But for PCOS alone, there is nothing like you do panchakarma for PCOS and your PCOS will get better. It is not like that. Like I said, there are five kinds. For example, in these five kinds, we have vamana, that is inducing vomiting. Then we have virechana, that is inducing loose motions. Then we have nasya, which is putting drops inside the nose as medicine. And there is rakta mokshana, where we do some bloodletting with the help of leeches, and Basti, which is the king of Panchakarma, basically in enema. Like I said, these are five, but there are plenty of about 40 kinds of supportive therapies, which are many kinds of massages and Shirodhara and all that. So, as a combination, we will choose the kind of Panchakarma suitable for a particular Panchakarma PCOS patient. For example, if there is an obese PCOS patient, we know that the patient will benefit from reducing the insulin. We know that the patient will benefit from reducing weight. Okay,
Mm.
so that is where we start. We start with something called Udvartana or Kashayadhara or Dhanyamladhara, several kinds of therapies which will help in reducing the weight and also correct the insulin resistance. Of course, along with diet and other things. But Panchakarma can do a very intense kind of treatment. It is a very intensive kind of treatment. Like you can think of it as a kickstart for your PCOS management. Because
Mm.
in about 15 days, it changes so many things in your body. So later, whatever you do, like diet, exercises, it will work better. And your mental health also becomes better. So let's say we have a lean PCOS patient who does not need to lose weight. Okay. So they can do some detoxification. We do that for obese patients as well. But Panchakarma is much more than cleansing your gut. Okay, that is just a very small part and the beginning part of it. And we know in lean PCOS, there are several hormones like prolactin, testosterone, and all that, estradiol, and also their mental health is an issue, and there's inflammatory responses as well. So we choose different kind of therapies, probably a basti with a shirodhara, with a different kind of abhyanga, a takradhara. So your doctor, your Ayurvedic doctor can actually look into the case and decide case to case what kind of panchakarma will help PCOS patients. But it is hugely beneficial, and that too when it comes to fertility, we see very quick results with panchakarma after PCOS. I see the next 3 to 6 months. We see conceptions naturally, like many times we have seen it, and I have also documented it. And Panchakarma is something all PCOS patients should explore because it has immense benefits for them. It could be any kind of PCOS, it will still benefit them. And the only warning is don't go in just for cleansing your gut and think that I have done Panchakarma and it's not done much for my PCOS. So it has to be planned according to your case, according to many things really. At what stage are you there? For example, if there's been spotting for a very long time, we will not start at that time. So we will choose something else. okay, to stop the spotting and then start that. Or if you don't have a bleeding at all for a long time, then we will choose another kind of panchakarma. Or let us say there is a patient with very low AMH with PCOS. Okay, we will choose a different. Everybody need not go and take a pill to have loose motions and think that they have done panchakarma. This is what I would really like for people to know, that it is not as simple as just taking some ghee and then taking a pill for loose motion and that is done. It is much more than that and highly beneficial for PCOS patients.
Wow. Yeah, that's very, very useful information, doctor. I think this will give people an idea on how to start and how to customize it with an Ayurvedic doctor to start with. Yeah.
Yeah, I think personalizing your healing is what is very necessary in PCOS and in everything also, and especially in PCOS. And
Mhm.
the first principle of Ayurveda itself is everybody is different. Okay, that's where the Prakriti analysis, the concept also comes from. So it's important for them to know that their Panchakarma needs to be personalized for them. And we know that exercise is so important for all kinds of PCOS actually, right? So please share some information about exercise and kinds of exercise and all that about which can benefit PCOS patients.
So, doctor, for PCOS patients, exercises are very, very crucial. The consistency is the key here more than the intensity, I would say, because intense workouts for PCOS women can actually trigger cortisol hormone, which increases that hormone and then further makes the hormonal balance worse. So, in obese PCOS, for example, I usually recommend them a combination of strength training, medium to low intensity cardio, yoga, and walking, all this. So, but very important for them to remember that they have to build their endurance slowly and gradually, because PCOS women often have inflammation and injuries can happen. So the intensity and the strain needs to be kept in mind. So it has to be very gradual, consistent, almost consistent. And lower end strength training with lower weights. So it again, as you mentioned, it's a very, very uh, particular thing for customization is required. Like in integrative nutrition, it's called bio individuality. So everything has to be looked at the person and then recommended. So, for example, in lean PCOS, I usually recommend a combination of strength training with weights, lower weights, and then walking, yoga, pranayama. All this will be very useful. Meditation, because mental health is very, very important to maintain here. So, this is the usual recommendation I advise. And then definitely another thing to keep in mind here is the weight may not move in numbers. Sometimes in obese PCOS, especially, you might not see weight loss in numbers, but there will be inch loss. There can be different kind of changes, and there will also be ups and downs during the period cycles. So these are very important things to remember to customize your exercise route for
A very
PCOS.
valuable point you said about the numbers not moving and the frustration and all of it. But awareness that, it will be different in different parts of the cycle. And during the healing phase, inch loss is also a very good loss. But you're still moving towards healing is very valuable. And
We've
thank you,
seen
Rashmi.
many cases, right,
Yes,
doctor, where inch loss is there. There are other parameters which would have improved in their PCOS journey, though the
right.
sometimes the weight remains the same.
Yeah, yeah. Probably building the muscle mass, which is much more valuable.
Exactly, especially with insulin resistance, the strength training, building the muscle is like a medicine.
Correct. I agree. Yeah, yeah. That's great. Let's keep the questions coming and we will choose the questions and answer them in our further videos.
Definitely looking forward. Thank you, doctor.
Thank you.